Hey y'all, it's Tosh with VSG for Baby B. I'm going to do I don't even know what to call it really, a PCOS, TTC, infertility, after weight loss surgery update, essentially. So I know most of you, sorry I'm moving stuff around, I know most of you all are here for just the VSG, just the weight loss aspect of stuff. So if this doesn't really pertain or interest you, it's fine. You can peace out now. But, excuse me. I have been saying I was going to do this update for a long time. And honestly, I've just not really been strong enough to. And I'll get more into that in a minute. But if this is the first time you've ever seen my channel, again, my name is Tosh. I am 26 years old. I had vertical sleeve gastrectomy on September 12th of 2016. And I have lost approximately 81 pounds maybe total from my highest weight ever, which was 341 pounds. So you do the math there. I think I weighed in this morning at like 260. So I have struggled for years with polycystic ovarian syndrome since I was, 14 is when I was diagnosed. And my husband and I had actively tried to conceive for right at about 5 years before I had the surgery. Well, before I started to have the surgery. Anyways, sorry guys, I'm scrambled and I was going to make notes, but there's no notes that I can make that are going to make this video any easier. Basically, the main factor, and not the only factor, but the main factor in me choosing to have weight loss surgery was to try to conceive. I have wanted my entire life to be a mother, and I knew from a young age that I had PCOS. I knew people that had it, that had kids, so I honestly it didn't click and didn't make me realize that it was going to be difficult, and it was very difficult. And through the struggle of us trying to conceive, I put on probably 60 pounds total. Yeah, right at like 60 pounds. And that's a lot. It's a whole lot. And it's not just because we were trying to conceive. It's not, because of certain fertility medicines. Yeah, they didn't help. But it's definitely, there's more to it. I know in my last couple of updates I've mentioned not feeling very well and having a hard time. If you struggle with infertility at all, or any other ailments, essentially, but I can only speak for the infertility aspect of it. The holidays are very hard, and I did not expect this year to be that hard, because this is the first Christmas that we've not been trying to have a baby, and that we weren't hoping to surprise our family with a Merry Christmas, we're pregnant. Sorry. This is why it's taken me so long to do this, because I get so emotional, and I'm blaming it on the hormones and the surgery and everything else. But if you all just bear with me. Sorry. But this was the first year that we've not hoped to do that, because we've been taking measures to prevent pregnancy, because I am fresh out of surgery. And I didn't think it was going to be difficult. And it was still really hard. I have nieces and nephews that I love dearly, like they're my own children. And I love seeing them open their gifts, and I love seeing the excitement on their faces. And they're all very young. The oldest is 3. So they're all at that just really fun age. Seeing my family and my husband's family interact with these babies, and seeing the joy that they bring to everyone, us included, it still hurts. And I know that sounds horrible, and it's not that I'm jealous of these children or anything along those lines. It's just strictly that I envy their parents, and I want that so much. I want us to experience that, and I want my children to go up close with their cousins, and it scares me that that's not going to happen. Even if we do have kids, are these children going to be older, and it's not going to be the same? Sorry, you all. I had to compose myself for just a second. But anyways, this month, December into January, has been harder than I thought. Not just emotionally, but physically as well. This is getting ready to be filled with a whole lot of TMI stuff, so if it's not something you're into, bye. But if you all remember some of my earlier videos, I had mentioned how my periods were so screwed up after surgery. And even with PCOS and infertility, I have had semi-regular periods my whole life. And I did not have that after surgery. I went probably, 2 weeks after surgery. I had a very small, what I thought was a period, which was about 2 weeks after my last period, and then it was maybe 40 days, 45 days between that and my next cycle, and then another 40 days until my next cycle. And this month, I actually had a 29-day cycle, which is more regular than I've ever been. I had a lot of signs and symptoms of ovulation, which was so exciting. I had the, sore, tender breasts. I had the, nausea, headaches, stuff that I've had. It sounds like pregnancy symptoms, but the same stuff I've had when I have ovulated in the past on fertility medicine. So that was wonderful to see and think, okay, my body's actually starting to work and starting to do what it's supposed to. But with that excitement, brought back a lot of hope, which is wonderful. But when you bring back that hope, you bring back a lot of, I don't know what the word is. You get scared. You get scared. At least I did. I do. I am. I don't know. I'm all over the place. But I realized, okay, I did all of this for this surgery, or I did all of this to have this surgery, to hopefully be able to have a family. And what if it doesn't work? What if all of this doesn't get me any closer to my goal of having a happy, healthy pregnancy than I was before? That being said, before I get all of the negative comments that I'm sure are coming, I don't regret doing this. Regardless, I do not regret this. But it is scary to think that the number one reason that I had surgery may not turn out to be how my life is supposed to go. And that's in God's hands, and I'm working on trusting His plan. And it's hard. It's really, really hard. And some days I do better than others. Believe it or not, today is actually a better day, hence I am doing the video. But I am getting a lot of questions from family and friends on, well, when are you going to have a baby? Now that you've had surgery, you've lost X amount of weight, you look great. When are you all going to start a family? And I didn't like answering those questions before, and I don't like answering them now. I'm more open now. There's more people that know about our struggle with infertility now than there's ever been. Honestly, I think because I just got frustrated. I got sick of the questions. I got sick of the nagging and the you're not getting any younger and, oh, look, your younger brother's passed you up. I got sick of it because I know these people don't mean it to sound hurtful and they don't mean it to be insensitive. But it is, and it hurts, and I just got sick of it, and finally it was like, okay, we've not had kids because I can't. As of yet, I've not been able to. You have no idea how hard we've tried. You have no idea how much money we've spent, how many doctor's appointments we've been to, how many ultrasounds, tests, medicines. And I know that there are people that have tried for so much longer and people that have struggled so much harder. And I am not in any way trying to say that our journey has been harder than theirs. It's just strictly, I got sick of answering questions. So you shut people up. And when people know that you've been struggling, at least the people I've, mentioned to, they tend to stop asking. It worked. It served its purpose. And with that comes added prayers and added encouragement from some people too, and that's wonderful. But it's hard enough to worry yourself about if you're going to be able to have a baby and if your body is going to be able to take care of this baby, and are you going to be able to are you going to have to go through these extreme routes of getting pregnant, or is it going to happen naturally? It's hard enough for me to worry about that, let alone to deal with other people worrying about it. And I know it comes from their heart and it comes from love, but it doesn't make it easier. That being said, and I know I've rambled a whole lot, and I'm sorry, guys. Just bear with me. I have spoken to my husband, and I have spoken with my doctor, thank God, from my work, and because I work with my doctor, I'm able to speak to her rather easily, so that's definitely a plus. But I actually had a sit down with her the other day at work and said, okay, listen, you know why I had this surgery, you know all this stuff, what do you think? And she said, basically, she wants it to be our decision, but she does not think that we need to wait a year before we try. And that is what my surgeon recommended for me, was 12 months. And I understand that that is what most surgeons recommend, not just because of the potential vitamin deficiencies and other restrictions that you have because of weight loss surgery and the difficulty that places on a pregnancy, but also because you want to get everything you can out of this tool. You want to lose as much weight as you can during this honeymoon phase before getting pregnant and having to kind of you can still live this life and you can still eat healthy and continue to make good choices, but there's a lot that you can't do while you're pregnant. You can't expect to drop big numbers the entire pregnancy. You can't work out as hard. You can't go as extreme low carb. It's not as safe. So my OBGYN said essentially that it is her experience that women that have surgery and lose drastic amounts of weight, their prime time to get pregnant is between 6 months to 9 months after surgery. And she is not pressuring me in any way. I don't want it to come across like that. But she is just telling me her experience, which is what I asked for. That puts me, I'm almost 4 months out. So March would put me at 6 months. I am in no way anticipating trying to get pregnant in March. I'm just telling you all where I'm at, where my head is at. I have spoken with my husband. We have agreed to wait. I have another appointment with my surgeon and my dietitian to get more vitamin level, like lab results, in March. So I'm going to see what those show, see if my vitamins are still good, make sure everything is still checking out okay, and then kind of reevaluate where I want to go from there. It's scary. It's very, very scary. I tried for so long, and you go through so many emotions, and that was a very dark time in my life. I look back now and realize I was depressed and didn't know it and didn't pull myself out of it, which I know is common. But it's scary to think about going back there. I don't want to be that person. And I don't think I'm that person anymore. I think that life has changed me, and this surgery has changed me to a point where I won't go into it with the same head that I went into it last time. Okay, so all of that being said, I am going to talk a little bit about how my PCOS has changed and been affected since having surgery. This is going to be the nitty gritty, okay, so I'm sorry, but my hormones have been all over the place, which is totally expected. I am getting to be more what I consider normalized, but the first month and maybe 2 months after surgery, I was angry a lot. I was very emotional very quickly. It wasn't a really good time emotionally, but that seems to have kind of passed, except for the stuff that brings, the infertility emotions and stuff like that to it. But emotionally, I'm okay now. The hair loss that everyone experiences with weight loss surgery in general, or, most everyone, that is also something that is experienced with polycystic ovarian syndrome. So I've always had hair loss, but it's never really affected me. I've just always had thinner hair. I don't know if it's worse after surgery because I have PCOS, but I definitely am noticing an increase in hair loss to the point where it's kind of scaring me a little bit. I do have extensions. I don't have them in right now, but I don't know if you can see, like, my scalp just looks like it's thinner. My hair is much thinner, and there's just not as much there, and that's scary. I feel like every time I move my hands through it, like, hair comes out. So that freaks me out, but I'll deal with it. I have dealt with, like, excess facial hair from PCOS, and I don't know if it's the vitamins that I'm taking, and I know it's a good thing. It makes your hair grow. I get that. It's not just growing the hair on my head. I have, like, these little chin hairs that are starting to get worse, and I don't like any of that, but it does seem like it's gotten worse after surgery. It's supposedly the more weight you lose, your PCOS symptoms resolve themselves, and, like, the facial hair and stuff will lessen. That does not seem to be the case with me just yet. I am looking forward to that day, though. I have noticed, aside from the irregular periods that I had the first few months, this last cycle that I had, it seemed like every one that I had got worse and worse in terms of heavy bleeding, severe abdominal pain, that I've always had bad cramps. I've always had at least one day during a cycle where I feel like I can't really do a whole lot. This last cycle, I can't remember ever having pain like that. And I don't have a high pain tolerance. Like, I'm not going to pretend to be some tough, chick. I'm not. But the cramps that I had almost made me call up my doctor and say, listen, you're going to have to check me out because something's wrong. And I don't do that often. It's been I've been very nauseous. I've not been wanting to eat because I was in so much pain, and it lasted several days. That went away, thank God. And I mean, I'm fine now, but it just seems like it's gotten worse, and it just makes you feel like crap. Aside from that, completely irrelevant to this entire video, I know you all have seen me, like, I've been coughing, sneezing, I've had all kinds of stuff for weeks now. I don't know what that is. I don't know if it's, like, severe allergies that I'm dealing with right now. A lot of people in this area are complaining of the same kind of stuff, so I don't know if it's some kind of weird respiratory virus, but I don't want people to think I'm very, very sickly. It's just that I've dealt with some kind of virusy type, respiratory stuff for, I don't know, 2 months now. It's like it gets better and then it gets worse, and it just kind of is a hit and miss. But that's completely irrelevant to all of this. I just have had a lot of people message me and say, hey, are you okay? You've been sick a lot. I don't think it's anything surgery related. I think it's just this area because I'm not the only one complaining with it. Okay. All of that, taking that into consideration, I don't know how many people there are that watch this channel that are following me for PCOS, TTC, infertility, that kind of stuff. So if you are, please let me know down below, because I'm happy to make more of these videos, especially as we start, trying to have a baby again, and I will, and I don't want that to make my followers that are here for weight loss, shy away. I don't know where the happy medium is for that. So please let me know down below what your all's thoughts are on that. I have, several ideas for different, like, fertility related videos. One of those, and this is completely crazy, but I have a hope chest that I started, 5 years ago when we decided to start trying to have a baby, when I thought it would be a little easier than this. And I have collected items and bought items and have items given to me for years, and I have them put up in a chest in my room for hopefully one day when we get to meet baby B, that we have all of this stuff to say, okay, mommy got you this before you were ever even close to being here. But I don't know if that's something you all are interested in seeing. I don't know. You all may think this is the worst video and the worst ideas or anything like that you've ever heard. That's okay. You can tell me that too. I'm a big girl. I can handle it. But I want to know your all's thoughts. You all are so supportive and so encouraging. There's no words. I say that almost every video, but there's no words to describe how good it is to have friends through this screen that can say, you know what, we're thinking about you, we're praying for you, we want the best for you, you know, if you need anything, let us know. Like, it's unreal. So thank you all so much. If you've made it to the end of this video, I don't know, you deserve an award, because it's going to be so long, and I'm sorry my emotions are not being as controlled as I had hoped, but I will do a 2-month, that's not true, a 4-month post-op VSG update next week, because that will make me, I think, 4 months out and 17 weeks, right at it, I think. So I will be doing that video next week. I hope to do another what I ate in a day or grocery haul kind of video here shortly, so that you all can see that as well. Any other video ideas or suggestions, please leave them down below. Thank you all again, and I hope you all have a great week. Bye.